I am Dr. William Carbary, and I'm here in my office today talking to Terry Harris. Terry Harris. And Terry, you've been a patient of mine since May of this year, 2016.
Correct.
Right now we're in late November of 2016. And why did you first come into me, Terry?
With horrible knee pain, both knees, I couldn't hardly even walk.
Okay. And why did you choose my office in particular?
My last resort was surgery, and I did not want the surgery, and I started looking for other things to do and came up with the cold laser, and it was you that was doing the cold laser therapy, and I called and started seeing you. So.
Okay. All right. Now you say you didn't want surgery. Was surgery recommended for you?
Yes.
Okay. Surgery on one or both knees?
Both knees.
Okay. And you were on medication as well.
Right.
And what was that?
It was a meloxicam. It was, as I understand, anti-inflammatory.
Okay.
And I was taking it once a day and had been for like 3 years.
Okay. And all right, 3 years. And you were on this medication, but you're still having pain. Is that correct?
Exactly. It was knees both still swollen, like, crazy swollen, big, twice their size. Just hurt to bend, to move.
Okay. How did this affect your other function, like going up and down stairs?
Everything. It was the basis of what I did every day. If I couldn't go to the store because my knees hurt so bad, if I couldn't go in and walk 5 minutes and get out, I just couldn't do it.
Okay. And you heard about the fact that I did a procedure, and what it was called was cold laser, and you came into my office.
Right.
And we started doing this cold laser, and there's an additional aspect to the machine. It also does vasopneumatic, which is a pumping action, a vacuum release 5 times a second. And what that does is actually it moves the fluid, the inflamed fluid, out in and out of the tissue spaces, so the lymphatic system can pick it up and excrete it from the body with a way of doing it that has no side effects, dissimilar to steroids, which you couldn't continually take for a long period of time. And after we started this therapy with you, how long did it take before you saw any difference?
I saw immediate difference that same day. I could tell that they were looser and did not feel as swollen. And we started out like 3 treatments 3 times a week, straight in a row. And by the end of 3 treatments, it was a vast improvement. The swelling was down. I could have more flexibility in my knees. I could go upstairs.
Oh, yeah.
Even after 3 treatments.
Okay. And this has been 6 months, more than 6 months since you were recommended surgery. And you continued to take the medication, Myoxicon, for until when?
It's been like about a month and a half that I've been off of it.
Okay. Did going off the medication cause any increase in symptoms?
No.
All right. And you went back to your orthopedic doctor.
I did.
And when was that you did that?
Early October.
Okay. Just a little over a month ago. And you shared with your orthopedic doctor how you were functioning, what the difference was in your symptoms.
Right.
And what feedback did you get?
I kind of felt like he was laughing at me and kind of just blew me off. And he said, well, we'll see if you need us anymore. Like, I was just full of...
It sounded like he didn't expect that you would continue to have good improvement or maintain the level that you're at right now.
And I asked him, I said, well, explain to me how I was off the meloxicam then. I said, I don't have the swelling, I can move, I can walk, I can go stairs. I said, I'm doing things I haven't done in 10 years.
Okay, all right.
And he just kind of...
And I shared with you because I knew that you were going to see your orthopedic doctor, and I shared with you to offer him my contact. I'd be happy to show him and communicate with him about this revolutionary treatment for knee dysfunction or any other joint dysfunction, really.
Right.
Did he seem to be interested in talking to me?
No, didn't show any interest whatsoever. I gave him a card and asked him to call you and talk to you about it. Told him I'd be glad for him to come up here when I had a treatment and see what went on and how easy it was and the effect. I said, you can tell. And he just kind of looked at me and quickly ended our
Yeah.
appointment time, you know, just kind of blew me off. Like,
Most people haven't heard of what we do here. The term cold laser that brought you in is something that is offered in many healthcare offices, and it's even used for Olympic athletes. And this is part of what this machine does.
Right.
But the one thing I shared with you, and the one thing I'm mentioning, especially when talking to you today, is the additional thing it does, the pumping, the vasopneumatic. This is not available in this kind of therapy anywhere else, because this machine comes from Europe. And it was developed for a different purpose.
Right.
And we discovered the effectiveness of this machine in this office. That was the extra thing you didn't know about when you were looking for cold laser.
right, no, I did not know that. So,
Yeah,
yeah.
And it's an amazing thing. And here's the other thing, and I'm sharing this with the audience as well, and I'm acknowledging that most people don't know that this kind of therapy, and that you're not just an isolated patient.
Right.
I've been doing this for over 10 years now. And I've seen a number of patients who were told that they had to have knee replacement surgery turn around and be able to function again. I've seen a number of patients that have joint pain in many areas that have gotten major results. And I'll share with you, and I'll share with the people that are listening and tuning into this video, that it's not a 100% thing.
Right.
And I told you that
Right.
going in,
Right.
that we would have to see, and I shared with you, if you recall, give it 4 to 6 visits and let's see
Right,
how it
exactly.
works for you. Because nothing is 100%, but this machine have achieved amazing results with many
Exactly.
people over the years. And I appreciate you talking to me today and sharing. Now, is there anything else that you can add or want to add?
The machine and you, or I told you one of the top 5 things, best things that ever happened to me in my life, and you're like number 4 on the list. I did have to put my
just
husband,
make
my
me
daughter, and my
number
grandkids,
Oh,
then you. So, you know, that's a big thing. But
Well, hey, that's not her. I didn't elicit that or even expect that.
But that's the truth.
Thank you.
I mean, you know, people need to find out about it, and I don't know how to get them to find out
Yeah,
about it.
well,
but
what we're
they
doing
need to.
here today is going to be available for other people to see. And I think that'll be helpful for people, and I think what you've shared here today is going to make a difference.
Well, it has totally given me my life back, the things I wanted to do, and I can do now. So
Oh, thank you
totally
so much.
has.
All right.
Thank you.
All right. Thank you. All right.